Well, the day is just flying by, and we've already heard from incredible speakers. But that is just the beginning, because the day's not over yet.
We're grateful that everyone's tuning in right now for your donations, but we couldn't do it without you. And I can tell you this right now. One of our next person is one of my favorites, and we'll get to that here in a second. But Sherry?
It's incredible. I want to thank Cleveland University, Kansas City, for really partnership with us during ChiroThon. For more than 10 years, Cleveland University, Kansas has been a mission to create a healthier world. And at Cleveland University, Kansas City, their focus is on health promotions. And it's about improving health, embracing behaviors to prevent disease, and helping people to do or restore their ability to enjoy the activities of daily living. Kansas is such a special place, but this university is really about educating the next generation of healthcare professionals, and they're student-centered, academically strong, and eager to help. We have one of the fantastic students helping us today, and I know that her career is going to be off the charts awesome.
I can tell you this right now. Professional Baseball Chiropractic Society, I'm a member of it, and Dr. Hammond is one of it as well. Super distinguished. You know, he's a DC here, you know, obviously a seasoned chiropractor, as a physician, and more importantly in the sports medicine world. He was a 97 grad from this location here in Cleveland Chiropractic, now Cleveland University. He began his career as an associate doctor at Westwood Chiropractic before founding Hammond Chiropractic Center, which he's led for more than 2 decades. He currently practices with Curtis Functional Health. Since 2022, Dr. Hammond has served as a chiropractic consultant for the Kansas City Royals, taking care of a bunch of my players as well, contributing to multiple postseason runs, all-star events, and a World Series championship. Show the ring.
No!
All right. He's an active professional and academic in leadership, serving on the Cleveland University Board of Trustees, where he has chaired since 2020. I did not know that about you. Yeah. Wow. He lives in Overland Park, which is right here, with his wife, Brandy, and their 2 sons. Doc, first of all, you know, thank you. You know, it's always good to have not only someone who's in the trenches, but is also leading where education is going with students. And when you look at this, I'm going to hand it off to Sherry here in a second. It takes more than just you, right? Right. And we've been talking a lot about teams. You know, we've had Dr. M on, we've had Toby, we've had a lot of different people on our live sides. But I'm going to let Sherry start it, but I want you to be thinking about that team aspect when I come back to you.
Absolutely. Okay. Well, you have been with so many teams. One particular you have some bling bling with. You've been doing this for over 2 decades, almost going into 3, but we won't age ourselves, will we?
No.
And so I wanted to ask you, how has since we have seen, you know, the beginning of where we had started our practices, because we actually graduated in the same realm in the same couple of years. What has evolved over the time that you've been in chiropractic and you've seen this elite performance has so incredibly changed? What for you has evolved?
Well, I think the involvement with me in practice with the sports team, initially when I started with the Kansas City Royals, less than half the teams had a chiropractor. So now all 30 teams have a chiropractor, which speaks volumes for chiropractic, the acceptance of it, but also the want of chiropractors to be a part of these major league sports teams. Personally, as I've treated patients and got more comfortable with that, getting to know them, you know, the main reason I go to the stadium and for the sports team is for the adjustment. They want the adjustment. That's what separates us from the physical therapists and the trainers. They do a lot of the soft tissue modalities, which I do some of that, but that's what they're there for, and they want me there to do the adjustment, which is the best part and the principle of chiropractic. And that was the education I got here, and it's worked out fantastically.
That's awesome. I love the A word. Alignment and adjustments are my 2 favorite words in life.
They are 2 of your favorite words in life. Not rest.
Well, there's a trust in reality too, and not rest.
True. But I think when it comes down to it, and this is our realm, right? And you and I have talked about this many times, and we teach on it, we speak on it. But so often people think about the peak performance, and I think this is one thing that gets misled sometimes, is that chiropractic is only for pain. And when we think about it, only 10% of that nerve fiber goes to pain. The other 90% goes to organs, tissues, and cells and function. Yeah. Talk about what you're talking about, because you're talking about the lane right now.
Right.
And for those that are watching, this is a really important concept in professional sports. because when you're in private practice, you may do more than what you do when you're inside the stadium.
Correct.
And when you're hired, especially as a chiropractor, the respect level of each profession is super important, and being able to communicate. And the athletic trainer who runs the system is kind of defining where your role is. Talk about why it's so important that you keep chiropractic inside the stadium.
Yeah, I think that's a great question and a great point to bring up. I mean, I'm very fortunate with the Royals. Now he's the medical director. At the time he was the head trainer. Our goal always, he says, is a neutral spine or as close to it as you can get, and a balanced structure or as close to it as you can get, right? That's what chiropractors do. Because baseball specifically, it's more times than not a unilateral sport. There's some guys that do switch it, so they become much stronger on one side than the other side. So you're having to work the opposite just about as much as you are the problematic side. And the goal of that is to balance that as close to as you can. But as you know, in baseball and professional sports in general, you want to get them to their sweet spot. Chiropractors, we want to balance it completely even. Well, they've been doing this for too long. Their body's guarded in a slight bit of situation or rotation that if you overcorrect that, their velocity might drop, their spin rate might drop. So you just get them to their point, and that's where they're good. And then that's what we work on maintaining. It's not about symptoms, about them functioning as best they can throughout the entire season and stay healthy.
And I think the other side of that too, sorry Sherry, is that in the off season is when we make major change.
Right.
And I think this is something that a lot of people misunderstand when you're wanting to work in professional sports, because it's like, oh, I just want to do all this stuff, do all this stuff, do all this stuff. Well, all of a sudden you've made a baby giraffe that doesn't know how to actually move their body.
Right.
And so it's so clear when you're working with high performance, it's that 1%. Yep. And we may only adjust one thing.
Yeah.
You know what I mean? It may be their ankle or maybe just one part of their spine, but that's all they need.
Right.
More is not better in professional sports.
Right.
Can you give us a situation or a story around that you've seen, especially like, let's talk two scenarios.
Yeah.
Talk one where a guy had pain,
Yeah.
wasn't going to play, and then had a chance to play.
Yeah.
And then let's talk about a guy who was kind of hesitant, but then you adjusted him and performance went up.
Yeah. Yeah, those are two great points. The performance one was actually just 2 weeks ago. We had a player that was struggling with some back issues, had not utilized chiropractic a lot in his life, had some experience, and I started working with him a couple times, and he just started kind of hitting the ball better, and it just, the amount of small differences that we make huge differences, but small to them that make a huge impact on their performance. So you just never know, and don't ever take, when you've been in the locker room, sometimes you know a player that maybe isn't really familiar with chiropractic. I still go talk to them. You go to, hey, are you doing all right? And they go, well, I don't know. We'll come back in the treatment room. Let's evaluate it. Let's judge that and see how good or how bad it is. Yeah. See if we can make it better. We had a player, the 2015 season. I'd actually been in the locker room treating players, had actually gone up with my family, and right before game time, the starting pitcher tweaked his neck, just in warm-ups. So we went down, I adjusted him. We got him on a trade, so I didn't know him real well, but we took care of him, and then he went and pitched a complete game. So you just never know when those opportunities are going to present, but you always got to be ready to go.
Yeah.
And there's a lot of travel for these players as well, and I think that's one of the things that really can impact balance. I love, so you used all my words, alignment, adjustment, plus balance equals chiropractic. And those are your ABCs for everyone listening today. Right. Is we're making our way through chiropractic with people that are really functionally in the locker rooms, that are talking to the athletes about performance and how performance is enhanced. But if you're traveling and you're totally fatigued, like you had the bad pillow that night, or do most of the players actually travel with their pillows?
They do not.
See, there's
that's
an
one thing
opportunity
I
right
know.
there.
I'm telling you right now, like,
they should.
I tell my players, especially ones that I work with, I'm like, hey, like because they're always like, man, I'm like, you have to travel with your pillow. You have to travel with stuff that that you sleep with. Right. Like the Shotani, they just did, they just talked about him, but he literally had a $300,000 mattress made specifically for him because he sleeps more than his rest is his recovery. Yeah. And they talk about it. He sleeps in the dugout. Like he wants a minimum of 12 hours a day. Right. And then he has a mat that he travels with. Well, there's a reason why he's one of the best players in the world, right?
Yeah. Yeah, travel, especially in baseball, right? There's 162 games, so the wear and tear of that season more so, not to say obviously other sports have the wear and tear, it's not as physical, but just jumping on a plane, staying at hotels, then if there's a rain out there, then they got to play a double header, and then the double header, it's extra innings, and so they're not flying out till 12 o'clock. They land at 3:30 where they're going, and they got to try to get sleep and be at a day game the next day. So rest, recovery, any way we can help and assist them to be as best they can be, as we're all in the same boat. The ortho, the medical, the PTs, the trainers, the chiro, we're all just doing the best we can.
Okay, so I'm sitting beside a player, and he is a World Series champion, and we're back and forth, and this is a true story and very interesting. So he's in a row all by himself.
Yeah.
And one of the ladies had said, "Oh, well, you could just jump back to the next seat." So I looked at him and I go, "Am I okay to sit here?" And he goes, "No, I bought the whole row." And I was like, I'm thinking he's joking. He's joking, right? No, I'm not joking.
Yeah.
But because you seem very nice, you're welcome to sit here. And I said, I'll be quiet. So all of a sudden he starts asking me questions. I said, you told me to be quiet. And he goes, I can't rest when I have someone asking for my autograph. First,
Right.
I didn't know who he was,
Right.
so it didn't really matter. But he told me about a World Series moment and how the chiropractor changed his life.
Yeah.
And I got so excited. I was like, and we became very good friends.
That's awesome.
Tell me about your experience, because you went to a world championship,
Yeah.
and you know the nerves, and he was telling me, like, every minute counts.
Yeah.
Every minute you have to be tuned in, you're finely focused. Sometimes it's just that one doctor that's going to make the difference. Tell me
Right.
some of the experiences you've had.
Yeah, obviously very fortunate in Kansas City. We had back-to-back World Series. We're in the postseason 2 years ago. It is when the stage gets bigger, the nerves get a little more tense, right? So, but you want to try to keep the players into their routine. You don't want to try to start changing too much. You want to keep, hey, this has worked for you thus far. Let's maintain this as we go forward. Something new pops up, we'll address it and talk about it and treat it. But yeah, you want to make sure that your nerves, as the practicing doctor, don't get too out of control either, because it's a bigger stage. All of a sudden, ESPN's there, MLB Network. You start seeing superstars and all these other retired players around. It's like, oh, I met Joe Torre at a game one time, and I was just like, wow, this is amazing, So, but you just have to keep those players, and I think part of our job is, one, to take care of them physically, but also just making sure mentally we're there for them. We're keeping them in a nice, happy place that they can go out and perform.
This is the teamwork. He needs to be in alignment just as much as anyone else to be able to be in a World
Sure.
Series stress factor, and you know that too.
Well, I think it comes down to, especially when you're working at that level, you have to live what you're preaching.
Right.
And they see it, right?
Yeah.
Like, if you're out of shape, if you're stressed out, if you're going through stuff, your players pick up on that.
Oh, 100%.
And at the end of the day, when you're working in high performance, your frequency drives that performance.
Yeah.
And so often, like, people are like, oh, I want to work in pro sports, I want to work with pro athletes, and I ask them why. Mm-hmm. And oftentimes it's because they want the credibility, they want this, they want that. I always tell people, like, you go to my Instagram, you're not going to know any of my players. You walk in our office, you'll probably know all of them, right? Or if you ask around. But at the end of the day, I don't care about their name.
Right.
I don't care about saying I'm the Dr. Blank.
Right.
What I care about is that I get to let them be a light, because they're on the highest platform in the world. Mm-hmm. And if they're vibrating and they're doing their best and they're performing, they're going to talk about chiropractic. They're going to talk about how their life's changed. That's going to change humanity. Like, kids are watching them, right?
Yeah, and I think that's a huge component, especially in young doctors. And I think I wanted it kind of for me initially, right? Oh, this is great. But really, you always have to remember, it's about chiropractic, it's about the organization, it's about the player. You can't it's not about us, right? It's about them and making them perform and making them succeed. And we're all a team. We all have to take the credit evenly throughout the other different healthcare practitioners, the coaches, everybody. So we have to work as a team to make sure we accomplish that.
And I think the thing too is, like, I never take credit for their success, and I also don't take credit for their failure.
Yeah.
And I think when you get too attached to that, it affects them.
Oh, 100.
And so, and especially as a chiropractor, I think it's, one, our profession's growing with respect.
Yes.
And I think people are starting to realize the importance of the nervous system side of what we do. And so building that collaboration in your community, and that, for those that are watching right now, like, even if you don't have a chiropractor, like, communicate.
Yeah.
Or if you go to one, if you have other practitioners, make sure we're all communicating.
Right. And you have to do that. And we do that always, because it's what, we all kind of have our lanes, so to speak, but we all if there's especially a challenging case, we all want to sit down and talk and say, okay, what can you do? How can you help this individual? This is what I'm doing. Okay, we don't want to do too much on this one area, so that we'll talk and say, especially the physical therapist and I and some of the trainers, because we all do our own mechanisms of soft tissue, but we don't want to do too much of that, right? A little bit, but let's talk about it. Okay, hey, I've already done that today. Maybe let's hold off and let's move on, just stick with the adjustment today. And I'll tell them what I've done and they go, okay, then I'll back off today. So it's a collaboration with all the healthcare providers, and it's a no ego zone. You have to make sure you get along with everybody, and it makes the environment better for us and ultimately the players in the organization.
They respect that, and I think what comes from you, Dr. Hammond, is something very special, is that you've been in the elite level. You've treated the players and they know who you are, but you also come down to the young people's level, is being able to see our future. I mean, that inspires me. That's why I'm here today, is that there's a mother out there, or a father out there, or a friend out there that is building an elite athlete, and it comes from the youth that starts to build. How does it differ when you go in after coming from a professional elite athlete environment to now you're going to Little League? And I loved my Little League years. Those were my favorite. Where do you go with teaching the parents? Or do they automatically see what you've already done and just kind of mold into it in an educational forum?
Yeah, that's a great question, because the kids, if you can kind of get them on that mantra of the neutral spine, the close to balance structures you can accomplish, it's going to be better for them not only at the level they're at now, but also the next level and graduate up. So my big thing with kids, and I always have the parents, the first thing I do is just evaluate them, look at their posture, and like, okay, Mom, Dad, look at this. And usually the kids, like, one side's down, their knees rolled in, and say, okay, this is what we're going to work on. We need to balance this structure. But if you can get that kid and the parents to understand that, then it's not only going to be better for them, it's going to be better for right now, it's going to be better for them as they continue to move forward. And it also makes it easier for the other providers. Let's say they go to the college level. So we're sticking to a very good, simple concept, but they understand it. So they go to college at UCLA or somewhere out west. Well, I'm not going to be there, but you can have somebody that can pick up the pieces and just keep treating them.
Well said, well said. Not wanting them to lose the factor of how important it is to continue their care. And with baseball, watching them, and it is like it's a unilateral sport. When you're swinging that bat, you have to recognize what balance really means. Or pitching, because you watch those pitchers and they're trying so hard when they're young to go as fast as they can, and their skill set and their techniques can be very painful to watch, because injury is just a moment away. How do you help them understand balance because of the sport in and of itself? Yeah,
well, especially in young athletes, one thing I talk to them about, because they're going to get injured if they, especially the amount of games they play in today's world in comparison to what I did as a kid. But I always tell them you can learn a lot from an injury. Take your time, don't get too upset about it. Let's learn how we can avoid this in the future. How can we treat this and then get you stronger so you can be better in moving forward? And that's something I really try to emphasize at different levels in each injury. We need to talk about that rather than, a lot of times the kids or the parents really absorb those injuries. You just have to say, it's going to be okay. You just got to make them feel better and then move them forward to the direction of getting them healthy, and then they can perform great.
And I think too, like, number one, I had no idea you were on the board here, and especially the chair. Education is so important right now. Especially when, students are looking at going to colleges, and, there's certain ones that are leaning towards a certain way and certain ones that are leaning towards another way. When we think about chiropractic, obviously you're on board here. How has Cleveland shaped your whole approach when it comes to your practice, and then dealing with like where you're at on the professional athlete side?
Yeah, I mean, Cleveland does an awesome, fantastic job of education here. Whether I was naive or just didn't know better, but when I got my diploma, I just went out and started practicing. I was very fortunate. It never was my expectation to get involved with sports teams. I got in with a professional soccer team first, and then an ABA basketball team. But I took the knowledge that I got from Cleveland, and I just started treating patients, and they kept getting better, and they kept coming back. And so I think all colleges probably I know they do a really good job. I think a lot of it is just within the doctor trusting in their education and believing in chiropractic that it'll take care of you.
Yeah, and I think the other side too that I want to touch on, because you mentioned this, and Sherry, this is a really important concept, is, I was blessed to help build On Base U, and that's an assessment tool that we use with our players. but I always say this: you can only throw as fast as you can slow down. And it's amazing to me how many parents, for the parents that are out there right now, especially when you've got an athlete, like you'll see the kid on the table and they'll have like their whole pair of spinals on the right side are just like this, and the other ones are like this. And I'm like, if they're a righty, I'm like, how much left-handed stuff do you do? And they're like, none. And I'm like, so number one, like we're gonna start working left-handed like kneeling throws. We're gonna start, training that other side. And as a parent, you can start to really gamify this. Like have the kids start, using a toothbrush on the other side.
Yeah.
So we're changing the brain. But if you like, as a parent right now, what is one piece of advice you would give the parents?
Yeah, it's okay to have a day off. I think so many times they think their kid has to play, and I always tell the kids and the parents, I'm like, you're not getting paid yet, are you? They go, no. I'm like, okay, then we got time. We can work on this. And like I was saying before, I always point out the instability or the imbalance to the parent and say, look, we have to address this. If we don't, they're setting up for shoulder problems, elbow problems, knee, whatever it may be. And so I really make them aware and why I'm doing this, and start talking about exercises and really working with them, talking about their nutrition, talking about hydration, the little things that they can do on their own. And then, okay, you need to come in here, but this is what our goal is. And if you can kind of put that in place for not only the young person that's playing the sport, but also that parent to wrap their brain around it, it makes it much, much easier.
Yeah.
It is. You said something that we've gone through a lot about baseball, but you said something even before that last answer about soccer.
Yeah.
So the excitement and the FIFA initiation.
Where are we?
All of the pieces that we're going to be. And you were right already in this world. So you know the excitement that's about. Tell me why you're excited and how you see the world seeing FIFA this year, because they've said it's going to be the most exciting and the most watched sporting event ever recorded in history. What say you about that?
Well, I think Kansas City is awesome. I just think the rest of the world needs to see how awesome it is, and that's what they're going to see. We have great people, we have great food, we have great stadiums, obviously, and our city loves soccer. So I think it'll be great for the world to come here and test it out themselves.
I want everybody to get so psyched about soccer. It's about movement. Even if you don't love the game of soccer, you'll probably fall in love with it during FIFA. And over the years where we worked with soccer players here, there, and everywhere, and we just had on Kieran McArdle, which he is an amazing individual who wrote just a fantastic book about soccer and how it leads to leadership. I just want to say to everyone in Kansas, I think you've got something extraordinary special. And since you've lived in this environment, soccer really brings people together. So I think we're going to have a lot of fun.
Football,
that's your football. That's it. Well, sincerely, thank you for coming on. Thank you for being the chairman of this fantastic university. We could not have been here without the charity of the goodwill that this institution has brought to us. Cleveland University has always been a great sponsor for the Foundation for Chiropractic Progress, and that has really made a world of difference. So Dr. Hammond, thank you. Thank you for treating the athletes, young and experienced, all the way up, and we love that. You're an inspiration and a motivator for all of us to do better, have better, and be better.
It's always good to have another brother on board. But we'll be right back after this quick break, so stick around. Don't forget that you can still donate. You will be also entered into the raffles for the gift basket and the adjusted reality. This is the perfect time to donate. We'll be right back.